Hello, my name's Diane Drexler. I'm the Vice President of Patient Care Services, Chief Nursing Officer here at Community Memorial Health System. I would like to share a wonderful letter recognizing some wonderful teamwork amongst our nurses and technicians here at Community Memorial Health System. I would like to express my sincerest appreciation for the most excellent care and service I received from Community Memorial Hospital. No survey can correctly convey my feelings for the treatment I received, and I hoped that a brief explanation would provide what a survey might lack. During my annual checkup with my cardiologist, a nuclear stress test indicated the need for an angiogram. My cardiologist, Dr. Shyam Patel, scheduled the angiogram for the 17th of March. I was able to complete my check-in, blood work, and COVID test at CMH on the 16th of March. The administrative and clerical staff, as well as the nurses and medical technicians, were courteous, professional, and expedient in processing and guiding me through the process. Upon arrival on the 17th of March, I found all of my paperwork ready, and I was quickly directed to the second floor waiting area where a nurse came out and escorted me to the cath prep and recovery area. The nurse, whose name is Olivia, was with me for the remainder of the day. Olivia validated all of my information on the hospital computer and began the prep work for my angiogram. She explained in detail what process I would be following that day. I was very reassured by her confidence and professional manner. Unfortunately, the procedure before me ran long, but Olivia was there to reassure me and asked if there was anything she could do. I asked her to call my wife and explain that there would be a slight delay and that I was fine. I cannot tell you how grateful I and my wife were that she made that call. The short delay gave me an opportunity to observe the normal activity in the cath prep area. What impressed me most was the absolute collaboration and cooperation of the nurses in that unit. When any nurse asked for help, the response was immediate and positive. "Sure, I'll take care of it right now." From my vantage point, I could see the nurses moving either alone or in teams to resolve all issues requiring their help, and I could hear the nurses saying my name is Olivia, Moses, or Jeff. How can I help you? Not only did they resolve the issue at hand, but they also genuinely interacted with the patients to calm and reassure them that they were the most important patient in the hospital. My turn finally came, and I was rolled into the cath lab. I was overwhelmed by the size and amount of equipment in the room. As I was wheeled to the bed, I was greeted by 4 lab technicians who each in turn introduced themselves and briefly described what they would be doing. These technicians were Tina, Max, Edmundo, and Ben. All 4 moved around me with practiced precision and began the process of swabbing, connecting, administering medications, and placing the equipment in preparation for Dr. Patel. I realize that this team probably performs this process more than a dozen times a week, but what impressed me was as they worked, each of them asked me questions about myself and my family or where I lived, and they responded with bits and related pieces of information about themselves. This calmed me and relaxed me. They were not robots. They were warm and kind human beings. Dr. Patel came in for a brief conversation and said he would begin shortly. The conversation with me and the techs continued briefly, and the doctor returned to say he had finished and had placed a stent in the coronary artery, and everything looked good. As the technicians began to remove the apparatus and equipment, they each briefly cautioned me about moving my wrist and reminded me not to do any heavy lifting more than 5 pounds or operating a vehicle for at least 24 hours. Ryan from transport came to bring me back to the recovery area where I was met by Olivia and a far more detailed description of the cautions given by the lab techs. I needed to stay in the recovery area for several hours while the pressure cuff remained on my wrist. Olivia returned several times to release the pressure, and she informed me she had to attend a meeting and that Moses would finish that procedure and bring me something to eat. Moses was no less gracious and professional than Olivia. As time approached for my checkout, Moses was working with the patient to whom he was assigned, and I heard him ask Jeff to continue my checkout. Jeff stepped in without hesitation and did an excellent job. I realize that this is a long way to get to my point. My point is that Olivia, Moses, Jeff, Tina, Max, Edmundo, Ben, and Ryan were the face of Community Memorial Hospital. I know that there are several hundred others in custodial, maintenance, clerical, food preparation, doctors, managers, and supervisors who make it possible for my team to take care of me. I can't help but believe that the people in the background have the same spirit and work ethic as my team does. On any scale, in any category, CMH ranks a solid 10 plus in any survey. Thank you and well done to all. Raymond. Thank you, Raymond, for recognizing this incredible team. I personally have witnessed that they perform these activities on a daily basis and that they are genuine and wholehearted. Thank you.